it's not just about the medication itself. So for that woman, you know, my question was, you know, how long, you know, was there a timeline? You know, when was it that, you know, when did this reflux worsen? And it was when she started talking about, you know, the stress in, you know, her life that sort of, you know, opened that whole conversation, and which then lead me to talk about, you know, those lifestyle intervention. So often, like, you know, say for example, last week, you know, I guess that's an integrated way of not just looking at the med itself, but looking at, you know, maybe there's certain nutrients that could actually help them, or mindful practice. For example, actually only a few days ago, I have a woman came in wanting some doxylamine, which is it's an antihistamine, but they usually use it to help sleep. And she also asked for some Voltaren, which is an anti-inflammatory. And so I was really curious because she was actually, you know, over that, you know, definitely at menopausal age. And I said, well, how often are you using this sleeping tablet? And I go, you know, I only take a quarter to half every night. My mind was going every single night. Okay, all right. And I go, well, what about, you know, the Voltaren? And she said, oh, look, you know, like I get aches and pain, you know, I go, she's obviously trying to do the right thing and, you know, doing training and all that. And she goes, oh, you know, sometimes I get, you know, aches and pain because I'm lifting. And I'm like, oh, and I was so happy. And I said, look, that's so good that, you know, you're actually doing resistance exercise. But she was, you know, I guess she wasn't actually expecting this conversation. But then, you know, I was then able to then open up and go, well, apart from sleeping, you know, what other, you know, do you experience any other symptoms? And then she talked about the hot flushes and everything. I was like, okay. And so that actually then gave me an opportunity to actually say, you know, have you actually looked at hormone replacement treatment or hormone treatment?